So welcome to this episode of Menopause Conversations. I'm delighted to have my guest with me. I've got Dr. Shilpa McQuillan with me. Shilpa is an accredited menopause specialist. She's a GP and community gynaecologist. And actually, you can find her at Berkshire Menopause Clinic in Henley. Welcome, Shilpa. Lovely to have you.
Thank you so much, Samantha. Really nice to see you.
Yeah, lovely. And we've enjoyed a number of conversations already, which is why we're laughing. We do laugh quite a lot when we speak.
Yeah.
But we do have a serious topic to talk to you about. But I'd like to give Shilpa the opportunity to introduce herself a little bit more and to introduce today's topic and sort of really dive into this, because we're going to be talking about cervical screening and all things around the cervix. So Shilpa, over to you. A little introduction from you, if you will.
Great, thank you. Yeah, so my name's Dr. Shilpa McQuillan. So as Samantha quite rightly said, so I'm currently an NHS GP. I'm an NHS community gynaecologist. And prior to this, I was a hospital gynaecologist in the Oxford region. And what really led me to open Berkshire Menopause Clinic was my patients recognised that in the area we needed a much needed service. Menopause care hasn't always been the forefront, has it, of healthcare, and we've got so much information going on now, so much publicity, which is brilliant. And so they asked me to, why don't you open up a clinic? We can't get all our friends to come into the GP surgery. They're not allowed to register just to see you. And so I just used it as an opportunity, already being an NHS doctor, to give another outlet for people to come, because I love being an NHS doctor, but we all know we don't get that much time. And I like to use the clinic as a way for people to have lots of time and a confidential space to give them that real time to talk about their needs, their intimate issues, things that they normally feel they can't just say in a rush in a 10-minute appointment. And also, give them that opportunity for follow-up, longevity. That's how I see things. That's my ethos. It's not about just people coming to the clinic. If they want to come off for a one-off appointment, absolutely. But my aim is to give you longevity, living your best life as well.
Yeah, absolutely brilliant. That's absolutely brilliant. And I think today's topic really underpins why it's so important to have that safe space.
Yeah.
Because we're talking about intimate health, really, aren't we?
Yeah.
For women. And Shilpa has written a brilliant article, which I'm sure we can make available, can't we, Shilpa?
Yeah.
A link to that. But within that, we know that this episode is going out in Cervical Screening Awareness Week, which is the 19th to the 24th of June here in the UK. And Shilpa has very kindly given her time to talk about this, because we know, don't we, Shilpa, that 30% of women don't attend screening.
Yeah,
why are women not attending screening?
So I think there's so many reasons. So the first thing is just to highlight that we hear so much, don't we, in the media, and people, of course, share their stories. And there's two types of people. There's people who've never had an intimate examination or a speculum or a vaginal examination, and they hear the horror stories that they get from other people's experience. And there's those people who, unfortunately, either the perception of fear, or they themselves, actually, we have to be honest, have had a bad experience for whatever reason that is. And so, of course, that then leads to post-traumatic stress. You then don't want to go and have that examination. And majority of the reason is fear. We have to be mindful. Obviously, we live very busy lives as well. And it's very easy, isn't it, to forget, you get that pop-up or you get that letter, come and book your screening. And people are busy nowadays. So that we do have to account for. Of course, that is some reason why people don't attend. But the majority is fear. And it's really important, and what I really wanted to address today with you, Amantha, and why this is so important to me, is that I feel a real need that it's my responsibility to either allay those fears, or if people have a genuine fear from pain that they've experienced before, how can we improve that for them, that experience?
Yeah, so brilliant. That's exactly right. Which is why we had a really great conversation, didn't we, a few months ago? And we both said, actually, we really need to sort of open the doors on this, quite really, and actually show people what is the intimate area. So we've both purchased something, haven't we?
Yes.
Quite
Do you want me to get it up on screen?
Which we're going to get up on screen, because actually part of allaying fears is to understand what you're dealing with, isn't it? And so we
Absolutely.
we've purchased a model, haven't we?
Yes. Are we
Are you
doing it
ready
on
the
1, 2,
count of
3?
3, 2, 1. So
Yes.
we thought we would use today to talk about, what is this we're holding up, Shilpa?
Yeah, so this is our vagina and vulva region. It's quite lifelike, I've got to say.
Yeah.
And the beauty of it is not only does it feel quite real, the anatomy looks real, but actually you can put a small speculum in, and inside is actually, you can view the cervix and what the cervix looks like.
Which is amazing. So whilst you're doing that, I played with something the other day. I'm going to show this to you, which is that you can shine a torch, can't you?
Yes.
On this, let me see if I can do it. Here we go. When actually you shine a torch at the back, you can actually see in the back there, and that is what is that we're looking at the back there, Shilpa? What is that?
That's what we term the neck of the womb, the cervix. So it looks like a donut. So it's a little bit difficult on your screen, but I've actually tried to imitate as if I'm doing an examination in clinic.
Perfect. Go
with
for
my
it.
light, with my light here, my speculum, and you can actually see it looks like the donut shape that you see, which is the tip of the cervix.
Exactly. And if we hold the model to the side, really anatomically, this tube here at the back, what is that representing?
Yeah, so here we go. So that would be inside. So here's your vulva. Inside is your vagina. When you go through with a speculum, you see that donut shape. That's the neck of the womb, the cervix, the start of the cervix, and then you see that little hole. And through that hole will lead to where your uterus is.
And that's where you will carry a pregnancy, right?
Yes. Yes.
Right. So can you show, can we sort of say to people, so that in itself is a whole education piece. And we know with social media, ridiculously, you know, we can say lots of other things, but the minute we talk about female anatomy, social media will either ban it, and it's just ridiculous because we're precipitating ignorance for people, aren't we, by not using correct terminology, not being able to talk openly. So obviously this series is called Menopause Conversations, but actually intimate health is important at any time point in a female person's life or someone with female hormones. So can you talk us through, I mean, obviously you've got some kit with you to show, haven't you? You know, because part of it is people don't know what to expect, do they?
Yeah, absolutely. So I just want to, the point you've just made about all kinds of, you're absolutely right. And so the article I've just written, so sorry, I should have probably said at the beginning, I write a regular monthly article. I'm the women's health columnist for the Henley Standard. So this is the kind of thing I do, wanting to just educate people and highlight things that you might not know. And you've made a really good point. The reason we both, well, I know that I've bought this kit is imagination can take over, can't it? And that's when we can sometimes get those horror stories, or we can imagine something. And what I like to do is, I think visual aids are really useful just to show people. And you made a really good point about every stage of life, and that's the beauty of having models like this, is just to be able to demonstrate. And I'm actually using my model next to demonstrate to sixth formers about cervical screening. And medical school students as well, because you know they start medical school or they go to school before they've even had their first screening, and so by the time they get there they have no idea, but they've actually built a number of horror stories in their minds about this. So this is one of the reasons I've brought this, is that just the idea of visual aids to help people. Now you're absolutely right about the hormones. So you know, right from pre-puberty to puberty, pregnancy, breastfeeding, you know, a lot of people don't know that we talk about, don't we, vulval, vaginal, urinary genital atrophy around menopause, but how many people know that you can get what we call post-breastfeeding atrophy? And
I didn't
so
know
many
that.
women,
till I read your article, I didn't know that.
Yeah, so lack of estrogen at any point in time reducing that hormone can cause atrophy. And so many women post-pregnancy get vaginal dryness, vaginal soreness, and nobody thinks to give them vaginal estrogen.
And this is the thing, isn't it? Because this is a cavity, isn't it? Largely, that, you know, that there's an entrance and the exit are the same place. And so there's a whole microcosm, a universe really inside of here that is so complex. And I even do things like this, you know, if you've got atrophy, really those tissues are just rubbing together. So I use my model when I talk to my one-to-one menopause clients, and that's why I say it's so important to put cream either side inside. So you're right. It takes away the fear. It gives people knowledge, and we know how empowering knowledge is. So you're absolutely right. So this is something right from the beginning. You know, I know the Davina McCall documentary was on last night about contraception. You know, we need to change the narrative, don't we? We don't need to discover this when we first go for our first examination. We need to know about this and be paying attention, regular examination and things like that. But you steer the lead now then. So now that, you know, if we help people understand a little bit of what we're dealing with, what's the point of a cervical examination? What is the point of it?
Yeah, so, well, firstly, I just want to highlight, you know, we said about we want to allay the fear. But remember, some people have gone through really traumatic experiences or do have vulvar and vaginal conditions. And in those ladies, it's not about allaying those fears, because those fears are quite understandably genuine pain they've got.
Yes.
The other reason I want to use my model to show them is to demonstrate you have this, or you've had this experience. What can we do during this examination? Let's demonstrate what things we might be able to do, what tools we can give you to try and make it easier when actually you've had a genuine experience. Because half the population, yes, their fear may have been what we say might not be not real, but do you know what I mean, might be from someone else's experience. But some people do have genuine pains and do have had the most horrendous ordeals. And so I want to use this experience not to try and dismiss that and say, well, you've got nothing to worry about, but actually you've had this. What is happening around this area that we can do things to try and make those things better? So that's the first thing.
And you talked about that in your top tips section in your article, which was about, you talked about support, about breathing exercises. You talk about a number of things which we'll come back to, but you did say that actually some people's fears can be so severe it can cause something called vaginismus or vulvodynia. Can you tell us a little bit about those?
Absolutely. So you get the involuntary spasms of the vagina. So imagine, I'm going to do it as a scenario.
Yeah.
Imagine you've had a really awful experience. So be it you've had some kind of sexual trauma in the past, or imagine you've had an experience where you've had an examination before and it was so painful. Or imagine you're having sex and you've had vaginal atrophy. We don't call it vaginal atrophy anymore because it's more to it than just the vagina. It's the vulva, it's the urinary symptoms, because we've got to remember to ask those questions. We don't just say, have you had vaginal dryness? We say, have you had urinary symptoms? So urogenital atrophy, we call it now. So some people have had that. And then they either have an examination or attempt penetrative sex. And what happens is your mindset remembers that awful time and you end up with spasms. Or you end up with something like vulvodynia, which is really painful around the opening entrance as well.
So can you show that on your model then? So where would people be experiencing?
Well, in the vagina as well. So imagine you're trying to have an examination or penetrative sex, and then everything just clamps around it, and you know you're getting these involuntary spasms inside the vagina. And then what does that lead to? It feels painful. It feels tight. Some people get pain then in their lower abdomen, deep dyspareunia. You know, these are all things that then it just becomes an absolute vicious cycle.
My goodness. And you can see that. I mean, you know, full disclosure here, I went and not my last smear, the one before, I actually had to say to somebody, can you stop? It just was so painful.
Yeah.
I just went, no, you've got to stop. And like I discussed with you before, because I'm very informed, I knew to say, can you stop attempting that with a large speculum? Can we show people what a speculum is, actually?
Yeah, absolutely. Because one thing I really want to highlight today is some steps that we can do to make
these. So let's go through that.
Okay, so I'm going to show you a range of speculums for a start. Now, you've read my article, and as you said, we can make it available. One of the things I'm very tongue-in-cheek about is my first ever smear. And literally, look at them. They're rackety. They're plasticky. When I had my first one, I don't know about you, Amantha, but it was that freezing cold, reusable ones, the metal, hideous, 20-something-year-old, you know.
Looks like from the Victorian era.
Absolutely. And I'm tongue-in-cheek in my in my article that I've just written in the Henley Standard about this, because when I remember that doctor coming near me and I thought, what is this animal head she's coming at? And actually it's called a duckbill speculum.
Well, it looks like that because it's got a rounded.
Yeah, it's a Cusco duckbill speculum because of this.
I mean,
and so all I remember was her coming at me with this thing. Now, obviously, I'm a bit tongue-in-cheek. The poor doctor didn't actually come at me like this, but this is what we have to contend with. But what I want to really highlight, and still I cannot believe this is still happening, this is your long medium. There's even a bigger, broader one than that. This is your medium, and this is your small. Look at the difference in sizes.
Yes.
Right? The one thing I want to first of all say is I will always go, you have to do a proper examination in someone, and if possible, I'll endeavour to use a small, because look at the difference just between that and a medium. Now imagine you've got vaginismus, imagine you've got vulvodynia, imagine you've got post-traumatic stress from penetration or having a procedure. Look at the difference that can make, having that and that. Huge. Imagine atrophy where, like you say, your vulva is stuck together.
Yeah.
You know, God. Sorry, and I'm portraying this like a horror film. I'm not trying to. What I'm trying to demonstrate, I hope clinicians watch this as well, who still do this. But actually, if you can use a small speculum, it can make the difference between someone not being able to tolerate an examination to someone actually being absolutely fine with it. And the way you can do that is, and I mean this in the least patronizing way to anybody, is a good vaginal examination. If you examine someone properly, you can tell the direction in which the cervix is facing, you can tell the length of the vagina to reach the cervix, and you can tell whether or not this is going to be feasible. You know, because what I think is awful is, you know, when you're examining someone and you're doing this to them. And you don't know which direction. You know, and if we can do a really good examination on someone, you already know the direction of your cervix, and you're using a small speculum, it can make the world of difference to somebody.
You're so right. You're so right, because that's what happened to me, and I knew my body, and I said, listen, I think they describe it as being retrograde, don't they? You know, sort of my cervix is retrograde, so it sort of points back a bit. So someone coming in like this, it's just, you know, it's unbearable. You're so right, and it is almost like that discussion first of all, isn't it? That's the bit that's going to put people more at ease. And you are so good, Shilpa. You don't do yourself justice in that you are so kind and caring, and your compassion is off the charts. You know, in the small amount of time I've known you, you always come back to, you know, we've got to make sure people are comfortable, that they're happy, they know what's happening to them. You've got, you know, we definitely need more of that.
Yeah. Do you know the thing that hopefully lots of women who, because it's funny you said about the Davina McCall, because I don't know when this goes out, I'm sure people will know Davina. Are we allowed to say what the documentary, and part of it, she showed her having her Marina core being fitted on TV. But one thing I always go back to is that feeling of being out of control. And that is what most patients say to me. You've hit the nail on the head, Dr. McQuillan. It's that feeling of out of control. Your legs are apart. You don't have control of being able to shut your legs. You don't have control of when this instrument is going in. And I'll give you the biggest tip that I do with my ladies. Obviously, remembering I do things like Marina calls under clean, sterile technique. But I give them the ability to put their hand on their lower tummy near their vagina, so that they've got some control.
Brilliant.
And I know that sounds, you know, almost nothing, but it can make the world of difference, rather than your hands being up here.
Yes.
And that is the thing that I think, even from my own personal experience of having these cervical screenings done, is just not knowing when something's going to be going in, not knowing.
Yeah, it's the anticipation, isn't it? It's the anticipation, because your legs are up. You know, you've got bright lights usually. You know, you're vulnerable. Let's be honest here. You're never more vulnerable than when you're in that position. And, you know, it doesn't always feel dignified. So if anyone can give you that sense that your vulnerability is acknowledged, that you are in a safe place, that, you know, we're doing this together.
Yeah.
My last smear was a complete dream. I didn't even realise she'd finished.
Yeah. Yeah.
And so that is the power. That's the power of what we're talking about. And I do feel, I know so many people, I have to work so hard to go, no, please go and have it. Please go and have it. And you're right. I really hope other clinicians and people in this sector are watching this, because sometimes it can be a bit bish bash bosh is what I'm going to say. And we definitely don't want that for people. We want to encourage that 30% to dramatically, you know, we want more people attending screening. So
and it's not about my, you know, I'm foremost a doctor. I'm a you know, my colleagues are very respectful to my colleagues. This isn't about bashing colleagues at all. This is
not at
all being aware that there are things we can do. You know, some people aren't aware we can use water-based lubricants.
Yeah, so let's talk about, let's get into that then, about what because you give out some really great top tips, which, you know, because actually as an individual we need to empower ourselves as well. It's not all down to the person who's going to be doing the procedure. What can we do? You've written a great list from your article. What can we do?
I'm going to start with pre-screening. So before you even come, you can arm yourself with information. Firstly, a lot of people, it's that unknown, isn't it? The more information you can find out or know. So this is where maybe reading about it. Now, I want to be very mindful. It's very easy to say to people, why don't you have a pre-cervical screening consultation? That's not necessarily possible in a GP surgery where, you know, we have a 5-week waiting list. We have to be realistic here. But where you have your ladies who, you know, really do say, I don't think I can come for my screening, I will say, look, book an appointment then in this situation. I'm not saying every single woman is going to be able to on the NHS have a pre-screening, but there are situations, aren't there, where where if it's a case of saving someone's life because just being able to get them to have their screening is going to be impossible, I'll book an appointment. And that's where arming yourself with information before you even have it done. Look, have a look at this. Let me show you how the speculum goes. Let me show you what can be done. Let me direct you to, for example, Joe's Trust.
Yes,
is one of them, isn't it? There's a couple I gave you.
Yes, you did, and help us help you. The Cervical Screening Saves Lives.
Yeah, and they've got videos of celebrities who've actually volunteered themselves, issues they've had, and how they've got around it.
Excellent.
So I'm not saying sit and do hours because that might make you more fearful for your examination. But what I'm saying is sometimes it's that not knowing. You know, you've got your 25-year-old. You know, doesn't have much experience and can only go by what her mum's told her, which is she had a horrific experience screaming the house down. That's not a great start, is it, to you?
No.
So maybe, you know, being able to sit with those ladies and being able to say, look, let's have a proper sit down and go through. So first thing is preparing yourself. That's what I would say. Anything we do with intimate health, I think, although it might not stem from a psychological point of view, but things do come back to the psychology of things. Let me give you an example. When you go to a fair and you smell a candle, I don't know about you, I smell something, it sends me back to when I have that lovely massage that calms me down. There's certain smells, isn't there, or visions that evoke those emotions.
Absolutely.
You might be thinking, where am I going with this? I tell people to bring music with them, because if it sends you to a place of calming, right, that music is what is my happy place.
Yeah.
And it may sound, again, ridiculous.
Not at all.
It evokes emotion and psychology in you that will send me to a place that I remember as being happy. And so I say, bring your music with you.
Wonderful. I totally agree. In my line of work, you know, fear is all about emotions appearing real. You know, so you know, we feelings and emotions appearing real. So if we could just dial all of that down, that's a great setup. It's a great platform. Yeah, absolutely. Brilliant.
The other thing, we all hear the saying, rabbit in headlights. Who needs bright lights in their face? We have the torches or we have the lamps, don't we? Yeah. I don't need the big lights on. I turn the lights off in my clinic if that's what somebody wants, because I have a great big torch that will focus on where I need. Yes. So if someone wants that music, they want the bright lights not to be on, let's do that. If that helps you feel calm.
Yes.
Then that's going to help you. Absolutely.
That's wonderful. And you also talk about some things that people can do even beforehand. And I think we spoke about this offline before, which is I certainly did, which was to use moisturizers or creams well in advance of your appointment. So tell people what we mean by that.
Absolutely. So first thing, we underestimate the use of vaginal moisturizers. And I know it becomes a bit of a saying, we wouldn't let our face get cracked. Why would let our vaginas? But it's absolutely true, isn't it? Why would we have really dry vulvas? So we underestimate the use of vaginal moisturizers. So firstly, I say to women, if you've got any dryness, any soreness that you feel could be related to dryness or moisture deficiency, use vaginal moisturizers. And they're things that you can use as much as you want, as little as you want, as comfortable. So you can use it, you know, 5 times to 7 times a week, but you can use it 4 times a day, as much as you need. So you could use that months leading up. And that's very different to a lubricant. So a moisturizer, the aim is to try and retain the moisture permanently. A lubricant is a quick fix during intercourse or during a procedure. So I'm talking about moisturizers first of all.
So do you reckon, I mean, because we need people to be careful in terms of what they're purchasing, right?
Yes.
I mean, certainly the brand that I do promote for menopause is the Yes brand.
Yes.
And
that's what I use.
Okay. So why do we both go for Yes? Can we tell people
the reason
why we prefer Yes?
We go for Yes, it's the ingredients in them, and they're very neutral. So one of the things with vaginal health is, and around menopause or hormone changes, is the pH changes. And those pH changes is what puts you at more risk of atrophy. It puts you at more risk of infections. It's more risk of the skin breaking down and becoming, you know, open wounds. And also we talk about gut microbiomes, don't we? Vaginal microbiomes are just as important, and that can also all interlink with your vaginal pH. When you start putting lubricants, or when you start putting moisturizers, you have to be very careful, because they can change the pH, and also they contain loads of additives. So by all means, you know, sex is extremely important. As I said to you before, I have no qualms about saying these words out. You know, I'm very, very open. I think everyone should have an absolutely incredible sex life. But we have to be very careful when it comes to certain lubricants have lots of sugar in them, lots of glucose. But, you know, because it's for play, it's for foreplay, isn't it? To be able to have oral sex and things. The problem with things, which you have to be careful, is glucose increases risk of thrush and infections, and then makes things more sore. So why I like Yes, I'm not a promoter of Yes.
No,
you know,
me neither.
But I'm a doctor who uses them because it's vaginal pH balancing, and it keeps it balanced, and it doesn't have lots of additives in it, and it's very neutral. And the other thing is, when you'll have your examination, there's no reason why neutral pH water lubrication cannot be used during cervical screening. It does not affect the results. So everybody should be using lots and lots of lubricant during a speculum examination to make it more comfortable for women. It doesn't affect your cervical screening results at all.
No, absolutely. And that is so important. And you can buy those in sachets, or you can get them in tubes. And they do. I did have a sexologist, Dr. Angela Wright, on quite recently. And she talked about it. So it's obviously during intimacy, you can actually have a double glide method where you've got water-based and oil-based. But just to be clear, always water-based in readiness for that examination for your cervical smear, because we don't want it to interact with or affect any of the results.
And the oil base is amazing. Double glide is absolutely brilliant. Just beware of condoms if you're using condoms with oil-based lubricants as well. That's the only other situation. Otherwise, oil-based, actually, a lot of women say to me, I know you've suggested to me as a lubricant, but actually I use it as a moisturizer, because the oil base, and coconut oil, by the way, is another one. Amazing for moisture.
Exactly. And so it's really important to know that. But I would totally concur about really read the small print on what you're buying, and to really know what the ingredients are.
My motto, Amantha, is if you don't know what 2/3 of the ingredients are, don't buy it.
Excellent. I'm going to use that. That's absolutely right. So we've covered, obviously, you know, what a cervical screening entails. We've covered how we can help people. I'd like to talk a bit more now about HPV, because when we talk about, obviously we're looking for the health of the cervix, to making sure everything's okay. What is HPV? How does it link to the importance of having cervical screening?
So HPV, human papillomavirus. Now, there are lots of different strains, and people tend to have heard of it because of vaginal warts. So vaginal warts, that is one of the strains. But there are a few strains that are also associated. So 99% of cervical cancers are associated with HPV virus.
Right.
Now, that does not mean if you have HPV, you're going to have cancer. That's not what that means. But it means cervical cancers tend to be associated with HPV. And that is why screening has now changed. So traditionally, the screening used to be tested for cells. Now they test for the HPV virus in the first instance. Because if you don't have HPV, the chances of having cervical cancer are minimal. So if you've got HPV screening, it's negative. You just go to normal screening, because they don't need to test anything further.
So tell me, so, I'm a woman of a certain stage and a certain age. I'm 52. How would I know if I had HPV? Because obviously there's been a very big campaign, hasn't there, in the early 2000s. My daughter has had her HPV
Yeah.
vaccine. They've actually given it to boys as well. Can we explain for people who don't understand why boys would need to have it, or people of an opposite sex, or people who are, gender fluid? Why is it available to everybody largely?
Yeah. So to answer your first question about HPV and the input, so it's associated with cervical cancer, but it's also associated with warts, and it's also associated with other quite rare cancers like vaginal cancers, anal cancers, mouth cancers, head and neck cancers. It's associated with them. And these affect girls and boys. But the important thing to know is obviously it's about herd immunity, because HPV is predominantly spread by skin to skin contact. Then what you're doing is you're protecting both parties from one spreading it, but also we forget that things like oral sex, you can get it through that. And so if you're in same-sex relationships, you can get it through oral sex. You can get it through a touching, and then obviously through penetrative sex as well. And so it affects both parties. It originally obviously started with trying to protect women from cervical cancer. So it started with teenage girls, and then moved on to boys for herd immunity.
Wow. Yes. And that's
the other thing I want to say is, yes.
Sorry.
Oh, so sorry to interrupt. What I wanted to say is that it's targeted currently at that age, because it doesn't, once you've got HPV, it doesn't stop it from developing. So the aim is to try and catch it in those who are less likely to have developed it already.
Okay.
Now you asked me, how do I know if I've got it? And the answer is you actually can't, because majority of us will actually have HPV, but we tend to get rid of it ourselves. So it tends to get within a couple of years. Hence why screening is every 3 years, because you tend to get rid of it yourself.
Excellent. So that answers a really important question, because sometimes people have said to me, is it too late to have it? But what we do know is certainly that, like you say, the HPV program is largely directed at younger people, but cervical screening is offered to anyone between 25 and 64, and apparently recall is every 3 to 5 years, and it tends to depend on your age. So it's really important to put that in your mind, at the front of your mind. And if you haven't had a reminder, you should be asking for that, and certainly following that up. So I then was reading in your article, which I know we keep mentioning, but it is so blimmin' brilliant that people need to read it. What are the signs that we should be looking out for that might lead us to think, actually, there is an issue here? Let's say we have been for our screening, but we're midway through our screening. What would be the reasons by which I need to be picking up the phone or getting in contact?
Yeah, this is such a good question, because before I even get to that, I firstly want to answer the first thing, where I said to you that most of us get rid of it and most of us don't know. This is why screening is so important, because it doesn't detect cervical cancer. It detects a virus which most people don't even know they have. So the first thing to know is, a lot of women say, well, I don't have symptoms, why do I need to go for screening? Well, that's the point, is that what we're trying to do is detect precancerous cells, so that if you do have HPV, if you have a high-risk variant that leads to cancer, you want to catch it before it gets to the point it's cancer, because we're not trying to detect cancer, we're trying to detect precancerous changes to prevent that from happening, because it's very rare. Even if you carry a high-risk variant of HPV, it's still very rare to get cervical cancer, because the aim is to pick it up so early. So the first thing I want to say to that is, most people wouldn't even know that it's asymptomatic. So that's why screening is so important to get it done. When women do get cervical cancer, again, it can be asymptomatic. But in answer to your question, which is a really good point, and this is what happens a lot, you've had your screening, it was normal, but then in between that, you may get in between your period spotting. You may get bleeding after sex. You may get lower tummy pains, pain shooting in your back and around into your legs, bloating. These are all symptoms that might suggest not only cervical cancer, but lots of different issues, can't they? What I'm saying to you, you're probably thinking, well, that could be, that could be a number of things.
Any number of perimenopausal symptoms, couldn't it?
Yeah, well, not just perimenopause, any women's health issue. Absolutely. It can, but the importance of why you want to go to your doctor to rule anything out is, one, it will obviously, you get an examination done, you get a vaginal examination, you get a cervical examination, and from that you can see whether infection, that's the most commonest cause of bleeding in between your periods, you know. And I don't mean things like STDs, but even things like bacterial vaginosis,
Yes,
you know, thrush, atrophy. How do you know someone's got atrophy unless you examine them? You know, you can't always presume the bleeding's coming from the uterus. We have to do an examination to do that. So a good examination, and then looking at your cervix. It's not just cervical cancer. There's, you know, very benign things like endocervical polyps, little skin tags sitting on the cervix that can cause it. So if you're getting bleeding, pain, any of those abnormal things, you know, whether they're, you know, in your screening or outside your screening, go in and getting it checked out to check what could be the cause of it. But at the same time, that will also hopefully help rule out if you've got cervical cancer and there's any abnormal changes seen on the cervix, then you will be referred to someone like a gynecologist or a colposcopy unit for them to look under the camera. Because if your screening's normal outside of that screening, as I said, that's not what the HPV smear is for. That's when you might need further examination under a microscope.
Absolutely. And we know this is one of the most treatable cancers, isn't it?
Absolutely. So this is why we've got a screening. Screening is that, I can't go into this, you know, to be honest with you, we'd be here all day, but it's one of those things, isn't it? It's weighing up the amount of people, you know, the numbers needed to treat that you're going to save versus the cost effectiveness. You know, there's lots of factors that go into it, but it's such a, you know, it's a devastating thing when it happens, but it's such an easy treatable gynecological cancer, which is why screening is so effective and important.
Absolutely. And so we must get into a mindset of encouraging one another. And I know lots of my menopause champions watch this video, and I know they'll be part of other conversations, you know, where people are talking about their health. We must really encourage one another to check in with one another and ask, like having your mammogram, and getting all of these things. We owe it to ourselves. We owe it to ourselves first and foremost. And we then, you know, actually we have a responsibility also for the people around us, because that, you know, lots of people are relying on us and needing us. But first and foremost, it comes down, we must value ourselves enough to make the time to go and do these things. You know, other things can wait.
Yeah. And so, actually, I want to bring up a point there. When I'm sitting in my GP surgery, we get a pop-up come up if someone, for example, if someone hasn't been for their screening, it will say screening overdue, not attended for screening. And it's so easy, isn't it, to say to that person, oh, I can see that your screening's booked due. Can you just go and book it? But actually, it takes a few seconds to say, can I just ask why you haven't attended? Is there a reason? Is something stopping you? Because that might reveal, well, doctor, to be honest with you, I've had the most horrendous dryness. There's no way you're putting a speculum up me when I can't even have sex. And that will then provoke me to say, let's give you 2 months of vaginal estrogen, and then let's try after that, because that will make the world of difference between an agonizing procedure. I've gone from people saying that they've had the most agonizing experience. I've given them 2 months of estrogen and they're like, I didn't even feel you do it. I can't believe that this is taking this long for this to happen.
You're so right. It's just that awareness, isn't it? To go, I need to know, just that, like you said, that little bit of extra time, and then it sort of really opens up, doesn't it? I mean, that's such a good point. And so as we sort of bring things more to a close, then, so in summary, if you were going to summarize what people can do, you know, in terms of readiness for themselves, let's assume most people who aren't coming, or who even are coming, are still fearful. What are the take homes that they can take from our session today?
So firstly, the importance of screening, because you don't necessarily have symptoms, and that's why screening is really important, firstly. 2, if somebody's not asking you, make them aware why it's difficult for you to, because there are lots of things we can do. And, you know, part of the things that I said to you, things that you can do for yourself, things that your healthcare professional can do for you, you know, so it's getting that support, isn't it? It's support, preparation. So look up, do your research. What does it, you know, what's involved in it? And that feeling in control as well. And feel heard, you know, say that I want to know what's going on before I come for that. I want to make sure I'm prepared for this appointment.
Yeah, I love all of that. And like I say, I just think you scream compassion if you can scream compassion, and you're so kind. But I did also want people to know a little bit more about you, actually, before we finish, which I used to ask this question a lot, and then I sort of said to you before, I said I'd quite like to know a little bit more about you, and we talked about people like, you know, people that, you know, who sort of impresses you, people who you respect, credibility, that sort of thing, and you came up with 3 people, didn't you?
Yeah, I'm going to be honest with you. You're going to be quite surprised. They're not necessarily medical at all.
Oh no,
So,
I love it. I love it. So
I've chosen 3 people I'd like at a dinner party.
Yeah,
Okay?
brilliant, which is lovely, because I think it tells us something about the person behind the camera and behind the story of cervical screening. So who are the 3 people that you would have?
Okay, I'm going to surprise you. This isn't medical at all. Dawn French, number 1.
Brilliant. Tell me why.
Because I think she's very funny, she's very clever, and I think she'd absolutely entertain me. I'll be honest with you, part of medicine, you've got to have a work-life balance. And she's one of those ladies I know, when I want to relax, I can put on something funny, like Absolutely Fabulous, or many of the things that she has done.
Yeah.
And not only do I think she's such a clever writer, she just brings a smile to my face. And for me, work-life balance, making sure I work hard as a doctor, but I've got to have something that makes me smile. And she's
lovely.
Can you imagine her at a dinner party?
Oh my God.
I don't think I'll be able to eat. I'll be too busy laughing, I think.
Brilliant. So we've got the comedy there for the dinner party. Who else have we got?
Right. Second one, Delia Smith. So you don't know this, I'm an avid cook. I'm a big entertainer. Yeah, I Umdenard going on MasterChef. So I'm a big entertainer and big cook. And she, for me, is the godmother of cooking. You know, I had her book when I remember this. Sorry, this is going to put, sorry, Dad. I remember when I was little. Remember when you used to get those magazines that say, subscribe to this? Yeah. I remember taking my dad's credit card and subscribing to Delia Smith books. I was about 10 years old. I didn't even know probably what they were. They just looked colourful with food. Amazing. And I thought, this is exciting. That's the first thing I did. And I got a bit of a telling off, you can imagine.
Yeah, I can imagine.
But still that day, I was 10. I'm now 41, Amantha. I've got that original Delia Smith book.
What a great story.
Godmother of cooking for me. And I think everything she does, you know, is very simple. You know, it doesn't have to be, I'm a bit of a fancy cook sometimes. I'm a home cook. But I just think, yeah. She's my go-to.
I mean, when is this party? We've got the comedy, we've got the food. Who's your last guest that you would have?
My last guest is Princess Kate Middleton. Now, do you know why?
No.
She lives in Berkshire. She's an absolute platform. And I think if I could meet Kate and meet her and show the passion I have for women's health to someone in Berkshire who's such a figure, I think I'd be able to sort the whole of Berkshire out with their women's health and menopause problems, because I would just love that platform to work with someone where I can get into schools and curriculums, you know, get in there as a young age. But, you know, and I'm doing that locally, but, you know, there's only so much little Shilpa McQuillan can do. Whereas I think someone like that has such an influence. And she's my age. She understands where, you know, I'm not saying she's perimenopausal, but you know what I mean? We're at that age where, you know, it's time to make that change for people our age, people younger than us, and really get into schools as well. And I think she could help me do that. So Kate, if you're listening.
yeah, wonderful. Well, you never know. I always say to people, put it out there, because magical things do happen. Well, that sounds great. Well, what a powerhouse. We've got 3 stellar women, actually. Dawn French, Delia Smith, Kate Middleton. You just need to give me the date. I can check my diary, and then I'll be coming over. I definitely will anyway, because if you're a good cook, that's something we do share. I love cooking. I'm very soulful about food. I think food can bring people together. But well, it has been an absolute pleasure talking to you, Shilpa. As always, you are such a great person to be around. You've got great energy. Your passion is obvious for everyone to see, and it's been really wonderful that you've been able to talk us through what is a really important issue that still, sadly, I think is largely veiled because of people's fears, lack of knowledge, but we do need to change that. It's so important for women at any stage in their lives, and so let's encourage people to take that up. So for now, I know we're going to get you back because there's so many more things that we can talk about. But for now, Shilpa, I'd like to say thank you so much for your time. How can people be in touch with you? How can they know more about you?
Yeah, so my clinic, Berkshire Menopause Clinic. So you can email at info@berkshiremenopauseClinic.com or go on my website, www.berkshiremenopauseClinic.com as well. And either, drop me an email, have a look at the website. I've got lots of educational resources on there as well. It's not just the clinic for me, it's about, doing lots of education as well. And I'd love to hear if anyone's got any ideas, or if Kate Middleton wants to get in touch with me.
Did we say that? Yeah, just say that again. And of course, you're on LinkedIn as well, aren't you? So we're
LinkedIn, social media. So all our Berkshire Menopause Clinic is both my Facebook and my Instagram, and then LinkedIn, I'm Dr. Shilpa McQuillan.
Yeah, lovely. But we'll definitely have you back. So for now, Shilpa, thank you so much for your time.
Thank you so much for having me. I'm surprised we have to end. I could talk all day with you.
I know. We said we would do that, didn't we? So no, that's brilliant. But we'll get you back for some more. But thanks for now, Shilpa.
Thank you.